Hey everyone, welcome back to my channel. My name is imazizbekrustamiy and I'm a first semester nursing student at Daytona State College. This week's video will be about testing. We have a test today, which I'm heading to right now. I'm excited, I'm nervous, all different types of feelings. Every time I'm testing, I get a lot of different emotions that run through my body, but I know that if I'm confident, I pass every time. You know, go in there with confidence, no matter what emotions I'm feeling before the test, before I start the test. Right when I start the test, turn everything off, turn on the confidence, and I just pass. I'll even get to show you guys some wound care I did with a friend, and it was really cool. We learned different types of stages in regards to like sores and whatnot. And it was really cool because we got to see. It was scary also because you see dead tissue and whatnot, but we got to see how to treat it, how to change the pads and everything. It was just a really good experience, and I'm glad I got to get some footage of that, which I'll show you guys. But right now I'm gonna be heading to school. There's a bit of traffic. Hopefully I'm not late. I'll be on time. But yeah, I hope you guys enjoy the video. One thing I like to do before, you know, going and starting the exam is just take a moment for myself in the quiet and just pray that I do well. And if I don't do well, that everything will be all right, you know. I can always come back because, I mean, I'm not going to do too bad even if I don't do well, because I know my limits. I know how much I studied. I know that I'm confident enough that I'm going to do well. Enough, at least, well enough. So, you know, I don't try to put myself down if I fail. I just learn from those mistakes and then come back better the next time. So, but right now, I'm just gonna take a few more minutes to myself and pray that I do actually do well. And wish me luck on the exam. All right, Mr. Smith. Pretend like I'm putting this stuff on.
For next semester?
Yeah, I did.
Yes.
Upset that the teacher's leaving.
Kelly Lane. She's an adjunct. She is in second semester, right? She's in second semester or third semester? Do you like her?
Yeah. Good stories.
Yeah, she's very good.
Okay.
Still have the smell?
Mm-hmm. It's a strong smell, man.
Yeah. Usually like cut it, but we just stick all of it in there.
We're just gonna stick all of it in there.
Yeah, I don't think she'd want us to cut it. So would you cut it or do you put it all in?
What? I just put it all on. Ours is really big.
Oh, this?
No, her wound is really
Our
big.
wound is big.
I think we can cut it. If she said we don't want it to cut it.
I don't know. I think that's what everyone else is trying.
Only for surgery. Yeah, that one, it's for surgery because when they close the abdominal cavity, things will be left behind. Or if we do a surgical procedure and we don't have time, every little gauze that you put in someone's abdomen, you have to count each piece. But if a patient comes in for an emergency, they'll just cut, do the surgery, close, and then what they do is an x-ray of the whole body to make sure we didn't forget anything inside. Guys, anyone has an idea of what the help desk number?
Here.
Help desk.
This one or this one?
For on top, we use the adult help.
Oh, this one, I'm gonna use that.
No. When you put this in there, it's just that.
I don't know how to put it. I don't know if I should go this way or just like this. I think
I put the edges up here.
It's just up here.
Yeah.
Okay. Why do they have a specific specialty for wound care?
Why?
Yeah.
Because I think it's such a big problem, like in the hospitals. Like a large amount of patients having pressure injuries, and you like need a specific nurse for that kind of stuff, doing all of it. And specific, like some patients require very specific instructions on what to do.
Yeah. I logged this earlier, but then I went to another computer, another classroom, and that's.
Like we call it Wound Care Wednesdays. The Wound Care team comes up on our floor.
Only on Wednesdays?
Wound Care Wednesday.
Oh, wow.
Every Wednesday.
But then the regular nurses also do it?
Yeah. If it needs to be done, they'll do it. But if it's like a huge pressure wound, and like it involves like wound vacs and stuff, then and it doesn't need to be changed every day, then the wound specialty wound care nurse will come in and do it. Perfect. Round of applause. Great job, guys.
What's up, guys? Oh man, I passed the exam. I didn't get the best score, but honestly with this exam I'm just happy that I passed, because the professor did say like this exam is usually the one that most people fail, and that holds them back, and I'm just glad that I just passed this. So I'm content, I'm happy with my scores. But now we just got 3 more exams left, then hopefully I'm done with the first semester. Oh man, I need to relieve all the stress, so I'm gonna go hit the gym, and I'll see you guys then. Piece of advice I'd like to give in regards to test 3, which is probably different for every cohort, which was what we were told would be different, but I asked past students and they said that they have the same problem with oxygenation, perfusion, and circulation, and of course the medications treated for those 3 main topics. What I like to do and what I was given, the advice I was given by my instructor, was use the ADPI method. You'll know what ADPI is by the time you get to latest, maybe week 2 of your first semester, and ADPI stands for Assessment, Diagnosis, Planning, Interventions, and Evaluation. I'm not going to go too deep into it because your professor or instructor will give a better definition and give you examples in regards to those. But with test 3, it was a very tough one for me. I definitely think I could have done better if I probably studied a bit more on those topics, which I was told by my instructor to study those topics really, in those medications especially. And when I got to the tests, I just had a big brain fart, and I think it had to do with me just overthinking, worrying, because of past students' experience. And one thing I probably shouldn't do is compare myself to them, because just because if they do bad or had a trouble time doesn't mean I should, you know. Nor should you. Always go with the least invasive routes. You know, when you come to a question and they give you medications, or having them sit up, if, like, for example, when they're having difficulty breathing, you know, sitting them up could probably be better than giving them some type of medication immediately. So use the least invasive method when you're treating your patients. And when you're just going over those test questions, always read all over the questions, all the questions, and just pick out which makes the most sense, of course, because you'll be educated enough to know which ones obviously make sense and which is the least invasive. I hope you guys enjoyed this week's video, and if this is content you guys enjoy seeing, please consider subscribing, as well as like and comment any suggestions or tips or questions you guys have for me. Again, thank you guys very much for watching my videos. I hope to see you guys soon. Thank you.